Alrighty, folks, treatment success secret for thyroid conditions, number fourth one. And in the third one, we talked about how you measure for TPO and TGB antibodies, thyroid peroxidase and thyroglobulin antibodies. That's the laboratory assessment for determining if you have an autoimmune thyroid condition. Because if the antibodies are beyond a certain level, elevated, then that means you're having an autoimmune thyroid attack, or condition rather. The fact of the matter is that, honestly, most people, they have a pretty good idea, or they already know they have an autoimmune condition because they have other autoimmune issues like rheumatoid arthritis or scleroderma or ulcerative colitis. A lot of people who have one type of autoimmune condition have another, because what happens with autoimmune conditions is the immune system starts progressively attacking other tissues if it's not regulated, which is why you need to work with a doctor who knows how to regulate an autoimmune condition rather than just letting it kind of take its merry course and cause tissue destruction, or just suppressing the whole immune system with high cortisol or steroid doses, which is not good. So most people already know because they have other autoimmune conditions. A second way that you can tell, though, is just through what you've been experiencing, is that the symptoms wax and wane. They kind of come and go. That's stereotypical of an autoimmune condition. A third way to know, and I'm not making fun of this, but a lot of people come in with a boatload of supplements. Okay, they're taking a basket of supplements. Okay, and they got a medical record that's yay thick, because they've been to a lot of doctors and tried a lot of different things in search of some relief, but they're not getting the relief that they need because they're not working with somebody who really knows about autoimmune conditions. Another way to tell is that their life really fell apart. I mean, really took a downward spiral, okay, or took a nosedive once they became sick. And for women, not always, but a lot of times it happens after their delivery, following a pregnancy, and that's because of the shifts in the immune system that happen during and after the pregnancy. So you need to get checked or via blood test for TPO and TGB antibodies if you're having a thyroid condition or suspect that you do, to see if you have autoimmune thyroid. But those are just some tips to kind of clue you in that maybe you do have that. Come in and get checked out. First 2 visits, $50. Call the office, 815-469-8500.